Women's health. Good morning, everybody. I'm trying to get that the old just for reference, the old presentation up, and the screen keeps freezing. Of course.
Of course. It's on. It's saved on Canva too, under the.
I just opened it up to see if I can get it to load. But in the meantime, welcome everybody. Today is May 10th, 2022. Time is 11:14. My apologies. Our apologies for starting late. We had another meeting that kind of went long, and so, but now we're here. And we're going to have a little discussion. And we invite all members of the community or anyone who has any questions to join us for this discussion to talk about the community health assessment project that we are involved in, being that Our first survey collection event is going to be this weekend on Saturday between 9 and 12. We wanted to give people an opportunity to um, ask questions that might uh, have come up, with all the discussion and advertisement and um, other things that have been coming out about the community health assessment. Because I honestly think that um, being that it's been so long since the community has had an assessment, a lot of folks are not necessarily familiar with what a community health assessment is, or um, what the purpose of a community health assessment is. So the conversation that we're having today is basically based. It's going to be based on that. Understanding what a community health assessment is, what its purpose is, what benefit there's going to be to the community, and the overall goal of what we are trying to accomplish with the community health assessment, and whatever other questions you all might have, because I think that it's difficult to understand, these things if you have never been part of one, or have never seen one, or are unfamiliar with it. The whole concept of, hey, we have uh, gift card for you, seems to be the motivation for some. But I think that people need to understand that there's more to it than just the uh, the gift card. There's more to it than just saying, "Hey, we'll pay you to come out and uh, answer these questions and participate in these activities," because um, it is extremely important for the success of all services, that are health and human services related. And, there are some questions in there about housing and things like that. So I just wanted to open up a conversation with the community about the community health assessment, and, offer an opportunity to um, answer any questions that might come up. You have anything to add to that, Rebecca or LaDon?
Um, yeah, I mean, I think, I don't think we can stress enough how important it is that people participate and give feedback um, when they're given the opportunity to. Not only because it's important that we get as much participation as possible, but also um, that's what's going to lead to changes. If you want to see changes in the community, if you want to accentuate our strengths, this is a great opportunity for everyone to get to say what they need to say, and form the community that helps them live their best life. So that's a good focus, I think, for everyone.
I agree. Actually, I wanted to add to that. I come from a small community, and um, we don't have any information on, some of the illnesses and the challenges within our community. And coming here and having this community health assessment really is going to give good insight on what's going on in the community. So we've reached out to individuals, really to have take part in what are the challenges, what are, they have that opportunity to talk about what they feel is important, some of the concerns that they have individually, like some of the difficulties that they've endured. That provides insight on, what we could potentially focus on. It's really putting together this report, this long list of public health needs, issues, problems, And so it gives us data and it allows us to interpret information so that we can understand the community. And so all of these resources, all of these different steps, they're really tried, they're really the information that have been implemented in other communities. We're not just pulling questions. These are not our questions. They're questions that have been used in other community health assessments. For example, the key informant interviews. Those questions that I pulled from a previous study. Trying to generalize it to the community was a little bit challenging. And then going forward, the questions for the questionnaire, the survey, that is also reliable information. They're not questions we put together. They've been used before in other areas of research. So that's something that we want to be careful and cautious about when we're gathering data and then also interpreting it. So we're doing what we can, and we're also learning along the way a lot about the community and just getting different viewpoints, and that's really important. So we really we're really grateful for the feedback that we're getting.
We've taken a lot of input from community members, not just the CHRs and the other health and human services staff members that are part of our department over here. We've talked to a number of folks in the community about what types of information is missing, that they'd like to collect, and we also pulled together the information that came about from the previous community health assessment, the one that happened in 2015. So we kind of had a general understanding of what information has historically been collected about the community with regards to health challenges and human services challenges, and we expanded on it because 7-8 years is a long time to pass, to allow us to recognize some of the challenges that the community has faced over the years, but in these areas, especially coming out of COVID, and some of the COVID really exposed a lot of issues that worldwide, pretty much, but in the community, we had a lot of individuals who, when COVID struck, their homes and their lives, some of these things that have been untreated and unserved for so many years, were causing complications for people. They were causing complications for their not just their physical health, but also their mental health and psychological health. And so what we wanted to do is when we partnered with Aztec to try to get this information and get this process started, those are the kinds of things that we're looking at, not just the historical data, the things from a long time ago that are continuing to be unserved and unaddressed. We're talking about even some of the new things that were kind of exacerbated, made worse by COVID, and by the conversations that we're having with people to try to understand what we need to do as a department and as an administration as a whole to try to resolve these issues. So these conversations that we had informed our process here. So the questions that we developed, yes, they're from validated sources, but they're also specific to Sinai. We made it very clear that San Ildefonso's interest is what we're worried about. And that kind of brings up one of the points that I wanted to make. Most tribal nations, bands, missions, pueblos across the country have historically relied on federal, state, and private funding to provide services for the communities. And what has happened in the past is that the information that was used for example, grant applications or funding proposals was based on generic information about Native American people and indigenous people that and that's what they used as for their grant applications, and that's what's been used for so many years. But the problem with that, with using generic information, is that it is generic to um, the entirety of the data has been collected about indigenous people across the United States, and that's problematic, obviously, because Southwestern Pueblo people are not the same as your Navajo Nation and your Seminole and Cherokee and Choctaw and Blackfeet. You're talking about these larger pueblos that actually provide access to that data that they were pulling from, and so even their traditional healing practices that were authorized by grant funding sources were used as the options for tribal communities. And if you are familiar with some of the other tribal um, traditional activities and spiritual activities, many of them aren't the same as Sanai, for example, or the Pueblo people of the Southwest. And so, if you are relying on these practices to inform what you do in your community, because that's what the grant funders are going to allow you to do, it's not going to work for you. You're not going to be able to do the things that are specific to Sanai to help um, provide services for the people of Sanai. And so, what happens with that? That means that the community gets neglected pretty much because you're only able to do things that are authorized by the funders. And so, having specific data to a specific community is so important to prevent cookie cutter service provisions and generalized services for communities. That is one of the primary reasons why specific community health assessments are required for smaller communities, especially like ours, because you can't use generic data, because that means you're saying that Sanai is just like everybody else that's indigenous. They're saying that Sanai is just like everybody else who identifies as Native American. So um, you can probably see the problem with that. Generalized data is not going to work for other communities like Senai. Yes, substance use is substance use, and mental health is mental health, and domestic violence is domestic violence. But do the people of Sinai solve their problems the same way as the people from the Southeast United States or the Midwest or the Northeastern tribes of the United States? No, they don't. So we can't use their generic data to support what we're going to do here in Sinai. So having these specific surveys, these specific questions, getting the specific information from the people of Sinai is how we're going to be able to work to solve these problems. And that's the reason why I wanted to make sure that people understand the importance of getting not just a few people to respond, but a lot of people from the community to respond, because you all are the holders of the information and data that um, that's needed to support grant applications and the narratives of funding requests and designing services for the community, because tribal data sovereignty has been a great thing for tribal communities. Keeping having the tribes own their own data, not having to put your health and human services data into some repository so that the public has access to it. All that is great. But the problem with that is we aren't like cities, states, and county governments that can go into some repository to get the data we need to support these grant applications and to inform the policy that the tribe is going to use to provide services for the people. Tribal councils are going to use this data, this generalized data from these community health assessments. The grant funders are going to use this data. Everything that's going to inform how we provide services for the community is going to come out of this community health assessment. And we're looking to use this data for about 4 years, because every 4 years is when the community health assessments need to be repeated. So I just wanted to make that clear to people, because I don't think that that's understood. We aren't collecting this data because we're nosy. We're not collecting this data because we just want to know about the community. That's the reason why all of this information is anonymous. We don't know who is completing the survey. We don't know who wrote or answered any specific questions. All we know is that the information that you're providing is something that we can use to inform the community health improvement project that we plan on doing at the end of this. So what we do is we take all the data that's collected from the key informer interviews, from the community surveys, from the focus groups, and from the what's the other?
You got it. The questionnaire, the survey, and the key informer.
Well, the community conversations that we're going to have with like service providers.
And the stakeholders. The stakeholder meetings.
Stakeholders. That's what I was looking for. The stakeholders meetings. That information is going to be used to inform the process that we're going to embark upon to start working on improving the services that we're going to want to seek out in the future, and it's going to make Sinai a healthier community and as a whole. Not to say that the community is unhealthy, but we all know that there are some challenges that we are dealing with regularly in the community. So we want to make sure that we put the community in a position where they can provide services for themselves and for the long run, instead of relying upon outside entities to do that for them. Do you have anything to add on that?
Yeah, I do. So really that Troy's talking about the community health improvement plan, like we're gathering information. And so what takes place from this list of needs, issues, problems, we could prioritize them into like a shorter, condensed list of goals that we can target. So sometimes, like I've been in communities where we've asked, we ask these questions like, why don't we do this? Why don't we try this? Why hasn't the department done this or looked at this? Well, because there's not a lot of information about what's going on, about prioritizing the challenges. And so that's what this plan will do. It will tell us of the limited resources that are really making it difficult, making health and wellness a challenge. So really kind of, it's a focused area that we can look at and identify. So that's one of the biggest solutions I see from this community health assessment. It's going to target what, answer those questions that we have. It's going to help us in that way.
We get a lot of questions about, we have these issues going on, and I'll use alcohol-related incidents that happen in the community. There are a lot of questions, about why is the tribe not doing anything about this, or why are these things continuing to happen, and there's no solution being developed to deal with it. And part of the reason is that there isn't a lot of information about how to do it. Not to mention, there's not a lot of resources out there that we have been identified as a resource to help us to resolve it. And so the reason why these things are called community health needs assessments is because community health is based on not just the needs but also the strengths of the community. So we identify what strengths are out there. What is a community already able and capable of doing to address specific issues, whether they're traditional means or they are family and cultural, influences that can help. Um, but also, what services are out there to be utilized to address these, whether it's Indian Health Services, or Circle of Life, or behavioral health, or Taylor Roots for behavioral health and substance use. All these things are out there, but how do we get them to work together to make sure we address these challenges? So we're not just looking at what the community is saying that they need help with or they have challenges with. But we're also talking with service providers and getting their input about what they can give us, what they can provide as options for us. Because we don't want to just sit back and say, okay, we're going to design these programs from scratch to be able to help the community members who are having specific difficulties. We also want to look at and identify those community partners that are out there that can actually help us by coming together and having conversations and saying, okay, you guys are having some of these challenges. These are the options and programs that we can provide. How can we work together to solve this problem? That's the reason why we have the stakeholders conversations, because we also want to know what other people out in the community, whether it's IHS or some of the other providers that are out there, what can they offer us to help us solve these problems? And so, but the primary question that has to be asked is, what does the community see as the issues that they would like addressed as a priority? And so when you are completing your community health assessment survey, or if you've already participated in a key informant interview, or if you're invited to have a conversation as part of the focus group, all of these are opportunities for community members to give that information about what's needed and what they see as what's needed, and also what they see as being a possibility to resolve the challenges. Because we don't want to, as a department, come up with the answers. We want you all to give your input on what you think will work. Just like we said, using generalized data or using like general concepts to solve these problems will not work for Sinai, because Sinai is its own entity. It's its own nation. It's its own people who need specific and uh, you know specifically developed processes and services to address Sinai uh, uh, challenges. So that's what this whole process is about. Is not trying to rely on Western data, not trying to rely on people's stereotypes and prejudices about not just tribal communities in general, but about Sinai, if there are any, and making it specific about what Sinai would like to see happen, what Sinai sees are challenges, what Sinai sees as what we need to try to work on addressing as a community, instead of having outsiders. I know that all three of us are technically considered outsiders, but we have an investment in the well-being of this community. And so we want to work on making sure that the services that are needed are being provided, and specific to what is needed by this community. So
Yeah, I mean, it's really important that that be the focus. You know, everywhere you go in the country, whether it be with Native peoples or non-Native peoples, every community has what are known as social determinants of health. And some have, everyone has their own um, uniqueness to their communities. And I think that's what's most important about this this assessment, is that we have an opportunity to point out and identify what's important to San I as a community? What is important to those of you that are within the community, live in the community, and what you would like to see in your future? So, the fact that we have a robust questionnaire. The questionnaire is focused on, it's got some pretty deep stuff on there, but it's really important. I can't stress how much that we want to hear about these things, because they help form community decisions, and it will help us better understand where everyone is in their life, and what they would like to see going forward, and also what the community's strengths are, and we can, when we are able to recognize those as as something that we can work with, that will help the other things as well. So we want to hear about all of it. So I mean, it's so important that we understand the uniqueness of the community. I can go onto a myriad of databases and pull information from all kinds of communities in the United States, but those don't apply, to this individual community, and that's what we really want to hear.
And I like the fact that you brought up social determinants of health, because
I was gonna say
sorry.
that. That's okay.
Social determinants of health, that because that is truly the, we talk about epigenetics, right? We talk about things that are genetically or genetically predispositioned to experience or go through. And then you also talk about the environmental influences. And so, the reason why there are differences amongst different Native American communities across the country, even though you all have a shared history with colonialism and some of the generational traumas that have happened as a result of the country being developed and created the way it was. Each community has its own influences within the community. These are those social determinants, those things that occur in your communities that influence how you all as a people are going to respond to certain things, including things like childhood trauma. There's going to be a section in the survey about adverse childhood experiences, for example, and people are pretty commonly overlook those as influencers of how communities develop over time, because the habits and the behaviors that some communities have picked up as a result of what happened through the colonialization of this North American continent have been passed down, and some of these things are being replicated in communities, behaviors or actions or responses to different things. And those things are what we refer to as social determinants, things that occur in your social environment that determine certain health outcomes. If you think about, just very simple things I talked about earlier about alcohol use challenges in the community, some issues that have come up, around behaviors and certain incidents that have happened. And, if you read through the 10 health indicators of the ACE study, and we talk about the behavioral health challenges that come out of being exposed to alcohol use. We talk about people who are experiencing behavioral health or mental health challenges in the household, and your children below the age of 18 witness these things. If there's domestic violence, if there's abandonment, if there's divorce, all these different things that come up, as a result of some of these social determinants of health, we look at how someone will develop, for example, an ACE score. adverse childhood experience score. And, the study has shown that if you have at least four ACEs, adverse childhood experience, things that you experienced that were considered negative before the age of 18, that you're at greater risk of developing very specific challenges in the future. You're at higher risk of developing a substance use disorder. You have a higher risk of developing mental health challenges. You have higher risk of developing type 2 diabetes. You have higher risk of developing coronary heart disease, cardiovascular disease. We can go on and on and on and on about these effects of specific things that have been passed down from generation to generation as a result of colonialism that is now still, all these hundreds of years later, still affecting tribal communities. And so we need to make sure we focus on not just the things that are in our faces. Your family member has been diagnosed with heart disease or diabetes, or someone who is having struggles with substance use or mental health. We have to understand that there's an origin to all of these things. And those are the things we have to identify and address and deal with and manage in communities. And so all of these things that's information that we can develop through a community health assessment and understand through a community health assessment. So we have to look at what's specific to San Ildefonso, because the experience of San Ildefonso is different from even your family relatives in Santa Clara or in Milwaukee or Tasuka, because the communities are different, even though they share the same bloodline in some cases. So we have to look at the big picture, and that's what community health assessments are designed to do. Sean, I was reading through your comments, and I'm trying to follow your comments here. You said that here's some stuff that I've gathered amongst community, just conversations that were brought up. And are you saying that the items that you typed in after that are those pieces of conversation? I want to make sure that we're clear so we can have this discussion about this, because you bring up a lot of valid points that I think we should touch on. So the availability of a specific resources. Now, we're not just talking about resources like a behavioral health therapist or substance use therapist or the thing like, we're talking about having opportunities in a community to do things that are going to overcome some of the challenges that we are identifying in the community health assessment. You're talking about physical activity and exercise. That's very important to understand. If a community has challenges with, for example, obesity or type 2 diabetes, but they have no opportunity to engage in physical activity in the community, or it makes it easy to you to participate in, how do you address those challenges? If you don't have access to a nutritionist or a person who's going to give you good, solid advice and information about dietary intake, like you said right there, how can we eat better with the food we eat during feast time? So what are better ways to prepare that? We are going to identify a lot of that in the community health assessment, believe it or not. There's questions in there about the types of food that the community not traditionally consumes, but out of convenience have consumed for whatever reason. And how do we make these? It's interesting because we literally just had a conversation about this in a meeting before this, about communities that are family members that have community members who have children who would prefer to eat ramen noodles over more healthy options for food. And so how do we talk about getting people to understand that we're not asking you to completely stop eating ramen noodles, right? But what's a healthier way to do it, to try to reduce the negative impact of some of these less healthy options for food? If you go back to your traditional ways of eating, would you be better off as a community with regard to health issues and disparities that are happening within the community. So, how do we address that? So, there's questions actually on the community health assessment that talk about nutritional intake and physical activity and access to specific services, things like that. Um, and just so you know, Sean, the fitness program is designed to address some of these things. We're actually trying to, yes, the beginning first phase of it is designed to provide access to gym memberships. But when we're talking about increasing the access to physical activity, we're talking about access in all different areas for all different ages, specifically ages 5 and up. Are you going to want to participate in a basketball league, or are you wanting to go to a camp, an exercise camp, or do you want to participate in, a marathon or a running program that might benefit you in the long run? The fitness program eventually is designed to pay or provide access to for community members to engage in those activities, not just gym memberships, but big picture. What if you can't go to the gym? What if you can't participate because if you're under the age of 14, you can't go to the gym by yourself. You can be there with a parent. So we need to make access to these types of things available to all members of the community. So, identifying these challenges. And again, that's right. So that's one of the things that when we identify these challenges, the community health improvement plan is designed to help do just that. Teaching community members how to eat, teaching them how to move, teaching them how to exercise, teaching them how to prepare their food and diets the right way. If we know what the issue is, we can work on paths to address those challenges and issues. So, the community health assessment's primary role is doing just that: identifying what does the community need, what are the community strengths, how do we take those two and make a plan to improve where those challenges intersect. Sorry, I'm talking way too much, and I'm going to give the other members of the team an opportunity to comment if they have it.
So maybe we're going back, but we were talking, or Rebecca brought up social determinants of health. And so looking in or reading about information of communities that are challenged with um, low physical activity levels, there's a lot of information about how communities don't have access to sidewalks, that don't have access to, um, street lights. And then there's also challenges. These challenges, well, like for example, one of the conversations we had a few days ago was about how could we increase more physical activity, individuals having people come out to walk. Well, sometimes we're a little bit nervous to go outside and walk because of the dogs that are not tied up. I'm nervous. I've been bitten by a dog before, and that keeps me from walking. That keeps me, I'm on guard, but those are some of the challenges. Those are social determinants. And then also I see that there are quite a few speed bumps in the community. That slows down traffic, and that could have been a social determinant if it wasn't there. So not having access to these, walking areas and safety is a concern. Those impact us and can keep us from being physically active. So I'm curious to know if you all feel there's other issues that keep you from doing things. That's one good example to provide. So I wanted to add that and include that. That's a social determinant.
Yeah, I mean, it's nice. it's nice to be able to get feedback from the community so we know, you know, what kind of projects could be in the future. For example, one of the activities I really like to do is ride a bike, and that can be challenging if you have a specific kind of bike. For example, I like to ride a road bike. That doesn't do so well on dirt roads. So, you know, it's good to know, for example, how many people may want to do that. Maybe a future project would be a bike path. Or if, you know, going back to Sean's comment that had, you know, the comments keep disappearing, but the bosque walks and things like that, you know, we don't want to obviously impose any too much structural projects on nature, but, you know, perhaps there's something that we can contribute to, like, for example, a walk that talks about the flora and fauna in the area, maybe for kiddos, maybe for, you know, high schoolers or adults or anyone who's interested. So, like, the nice thing about doing the community health assessment or the community needs health assessment is, you know, we learn about all of the aspects of the community, you know, the environment, the services available, you know, for example, you know, trash pickup is one thing. That's a big community thing for everyone. You know, there are communities out there that actually don't have that kind of service. Sometimes people have to, when I was a kid, we had to bring our stuff to the local dump. So having that, that simple, what may seem as a simple thing, is from getting feedback from community, to let them know that we need this service. This is important to us. This is something that helps us function more efficiently, and live a better life, because we're not focused on hauling our trash once a week. I mean, I know that seems like a simple example, but it does make things a lot easier when somebody comes by and does that. Other examples are, you know, maybe library programs, for example. We have a library. That's something not every community has. A lot of communities do, but sometimes that resource is contested by people. So, you know, it's important we are able to support those kinds of things that we already have, but also add value to them for people.
I'm looking at Leanna's comment about listening to our bodies. I think that's important. We had a conversation a few weeks ago or a few months ago about how being mindful and considering how, you know, the foods that we have on our plate. It's very difficult when you've been possibly deprived or you had to go without, and you end up, you know, with these behaviors where you end up taking more because you don't know if you're going to have anything later. You know, you don't know because of how you've been raised or how you've grown up. Being raised in a big family and having to share very little, I tend to do the same, and you know, without realizing it, I'm taking more than anything. You know, more food than I need to, not realizing, hey, this is not mindful. I'm not hungry. I just ate. It's one of those habits that we learn growing up. For example, maybe for some individuals, you could think of it as, you know, you have a dinner, you eat out, big dinner, but then you go to the movie theater and what do? You buy popcorn again and, you know, your soda. It's like, that's a learned behavior. That's kind of, it's different, but it's along the lines of trying to understand ourselves and be mindful. Do I want this? Is my body full? How is my body reacting to what I just ate? Some of those things are a bit difficult when we've been raised without or didn't have much. So I want to add to that. But one of the initiatives or one of the things, one of the projects I want to implement is working with the students and talking. We did talk a few times about mindful eating and really tasting and identifying flavors and foods. And I think we're going to go through that in the summer. So I just want to add that.
Yeah, Sean, that sounds like a great idea. And Leanna, that sounds a little scary. I hope that, hope that doesn't happen, but also, that's why this community health needs assessment is so important, because we want to, hear about these ideas so that we can say, hey, so many, a couple of people over here have this great idea, so let's go with that. Or maybe there's something we can do with the blind spot that we can help protect pedestrians, children and adults. So these are all really awesome ideas. I love seeing this. This is great.
That last comment that Leanna posted, I have this conversation with the group a lot, and with other people, because it's even around, and I'm not laughing because it's funny. I'm laughing because it's like that's like bingo. A lot of people do things and live certain ways because they don't understand certain things about their body, about the how the body works and the functionality of certain body systems, and you rely on your medical providers to make every decision for you, because you don't really understand how have consuming too many carbohydrates might you know it might create a problem for you in the future, not just with regard to your endocrine system, or with diabetes, or with liver issues because of fatty liver, because your body's storing too much fat. All these different things that can come out of these different challenges, because you don't know how your body is working. How is your body processing and using the nutrients that you're consuming every single day? Why is that not being taught in school the correct way so that people understand it? Make it interesting so people can kind of, and we were talking about this, before, like people will come in and they'll make a comment about something about their physical body or some sort of condition. And my question is, didn't you learn that in school? But a lot of time the answer is, well, no, because it's not taught in a way that people understand. So making sure people understand how their body functions, how the food that they take in affects them, how lack of exercise and lack of movement can create challenges for them in the future. How, and then you hear people say, let's just exercise. Well, what is exercise? Is aerobic exercise the only thing you need to do? Or should you incorporate um, resistance training or strength training, because that is going to keep your bones stronger in the future? Um, yes. So, and that's the things like, or for diabetes, for example, I say, get out and run, get out and run, get out and run. Well, the best way to stop free floating glucose in your bloodstream is to give it some place to go where it can be useful. And where is that? It's in the muscle. So if you're not doing any kind of resistance training or any kind of muscle building exercises, your body, because glucose gets stored in the muscles as glycogen, so it can be used later on, right? So it can be used for fuel later on. And if your muscle mass is really, 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 really low, sometimes that glucose doesn't have any place to go, so it floats around in your bloodstream. So your fasting glucose is going to be a little higher than it should be, because it has no place to go. And I mean, that's a little bit much to talk about, but I just wanted to make a comment about those things need to be understood. But if you aren't told that, if you are not being educated about that, if you're not being given that information at an early age, it needs to be given to you at some time. That's why we need to have diabetes prevention classes here in the community. That's why we need to have these different courses, different trainings, different meetings, different, town hall meetings or seminars or presentations or whatever you want to call them, to make sure that people, if they were taught it, they're reminded about it. Because if you live in a community where type 2 diabetes is a very common diagnosis amongst your relatives, You might want to have a method or opportunity to provide that extra um, um, information, benefit, so that people can understand what can they do. Maybe they have type 2 diabetes, but guess what? It can be reversed. How can you reverse it? How can you change how your body processes glucose? How can you change that? So when we are talking about community health assessment and understanding what the community needs, we need to understand all of this. If you're missing something, there's going to be a comment section about on your survey, for example. If there's something that you feel is not covered in the questions that were in the community health assessment survey, you can actually write a note on the bottom, because we can't think of everything. We had to use validated questions, so things that have been used by different community and scientifically verified in the past to get the right amount of information from folks. But that means we can't have all the questions on there. So you all are the ones that have all the answers. So putting comments in the bottom of this bottom section of the survey when you complete it is important, because that is going to give us some information that we weren't able to collect through questions. And it doesn't have to be all health and human services related. If it's something that we can provide um, input to the administration about, that could be really closely related to this, like you guys are talking about environmental safety, speed bumps, or things about speeding in the community, or things that put the community members at risk. Those are those are things that are health related, right? They're environmental health. Guess who works on those things? The community health representatives, the CHRs. They're in charge of environmental health in many cases in the community. So we could actually utilize whatever information you put in there about these things to help educate not just the tribal administration, but also tribal council about those things that they may not be hearing from members of the community. So this is a great opportunity. We are The flyers up on the screen. We're going to have our community health assessment, the first gathering of the surveys in person. They're going to be at the senior center building here. You'll be able to come over and complete your survey. You'll be able to get your incentive, which is basically a $50 gift card, and you're going to be able to eat. There's food. Always great to have food when you're going to using your brain to identify all these different things. You're going to probably get hungry, so we're going to have food, and we're also going to have Ladon's favorite thing is the fire truck. People think that that's a weird, funny thing, but we've been teasing LaDonna about this for months, because she says have a fire truck. So she got together with Natural Resources, and they're going to be bringing out the fire trucks that have been pretty much dormant for probably 25 years. They've been sitting in that stall there for a long time. So if you want to see your semi fire trucks, some folks that are going to show up have never seen them before, because the last time they were used was before they were born. So the opportunity for that is there as well. Just kind of bring people together. The first major, big activity that we're trying to have post COVID, while we still have low numbers in the community. Uh, dunk tank.
I thought
That's
about
a good idea, Sean. The dunk tank would be great.
John.
I think that I've actually seen those things go, like, everybody goes, especially when it's hot outside. Everybody goes to the dunk tank. They disregard everything else that's going on when they go to the dunk tank. That's a really good idea. We might, see if we can get the TA to authorize that. We can have one of those at the next event, because this is not the last time you're going to have to complete the assessment. This is the first in-person one. There will be a second in-person one, and then we'll determine after those two in-person activities are done, how we're going to get the rest of the community access. I know some people can't show up; they won't be able to come in person, whether it's because of mobility or transportation issues, or because they're busy doing something else. We want to give everybody an opportunity to answer the questions. Um, uh, Are you talking, Leanne? Are you talking about to describe the community health assessment process? Oh, So Sean, what'll happen is we'll do this first one in person. Then we're going to do a second one, probably either a week later or 2 weeks later, to give everybody an opportunity to participate. And then we're going to work on possibly having them delivered to, because we don't have it, we're not going to know the identity of the people that are actually completing the assessment. So Aztec has a list of community members that are assigned unique identifying numbers to identify those folks who are eligible, those 18 and older folks, to complete an assessment. They're eligible to complete an assessment. We're going to know by the numbers. They're going to let us know which number turned it in and which ones didn't, and then we'll let them. And then after the in-person events are done, they will basically send mailers out in the mail. Well, they're going to provide us the mailers in the envelope, and then we'll actually drop them in the box to get mailed to the people. But then you'll be able to do the assessment on paper, and you'll have that opportunity that way as well. Because when the Saturday event, there's going to be an opportunity to do it either on a tablet, so you can actually digitally put in the information, or you can do it on paper. So we will. You'll have an opportunity, whether it's this Saturday or it's another day. But anytime you complete it, you'll be at that number that you're assigned, that each individual in the community is assigned. Will be will notify Aztec, and then the gift cards will be provided for those folks as well. So even if you don't get to do it in person, you'll still get your opportunity. And Leanna, we are always working on that. I'm gonna put your email in there.
Yeah.
You always have an opportunity to. I forgot what I was going to say now. Lost my train of thought. I just wanted to make sure that everybody understood that this process has been a very difficult but rewarding process. We've been trying to be as mindful and as respectful as we can to the community, considering we're not from here, but also trying to elicit the best and most effective information that we can to try to help improve the health initiatives in the Pueblo. And so, we welcome all participation. Our goal is to hopefully get 100 surveys returned to us, and because that'll be double what we got at the last time. But it would be great that out of the 368 eligible 18 and over community members that are here, that we got 368 surveys returned. It doesn't mean that that's going to happen, but I would love for that to be as close as possible, because all information is important. All input is valuable, and we would like everybody to have an opportunity to give their input. And just as an announcement, as of yesterday, we actually have a signed contract for the Milwaukee Wellness Center. So in addition to the Anytime Fitness locations, any community member that wants to be part of the fitness program through SDPI, you also have an opportunity to sign up for a membership at the Milwaukee Wellness Center, which, like Sean was talking about earlier, gives you access to the pool. The pool is open for swimming. So contact us in person, contact us by phone, or you have members' emails that you can email us and get information about how to apply for the fitness program. But we have been trying to do everything we can with the resources that we have to work on some of the challenges that exist in the community, whether it's nutrition education, because we still have nutrition consultations that are available to the community for free. We have the gym memberships that are available to the community for free. We have our nutrition education programs. We have our health education processes. You know, LaDon is and Rebecca have been really instrumental in bringing a lot of really good information to the community. There's a lot of work that has been done over the past year that we're really trying to help improve some of the things that we do know about. But the community health assessment is going to help us to better understand those things as well as identify the ones that we don't know about. So I'm going to stop talking now and let Rebecca and LaDon provide any final comments before we disconnect. And just want to thank everybody who participated in the question and answer session, who provided comments, who were tuned in and watched live, and for those folks who are going to watch this recording later on. Really appreciate you taking the time to spend with us to talk about this really important process. We will have the event on Saturday, 9 to 12, to do the community health assessment questionnaire surveys, as well as the vaccine clinic that's going to be the same day, same location, between 1 and 3. So if you know anyone who needs to get their original initial vaccines or their boosters, or they're eligible for that second booster, which is the 50 and older or immunocompromised, 12 and up immunocompromised, we'll have all that available for you. So, like I said, thank you all. I appreciate the time that you took with us, and I'll turn it over to the rest of the team.
Leanne, I just wanted to comment and respond. I feel like the tribal council is on board. So they've been really supportive in many different aspects. So we are getting response from the council. And so we'll let them know and inform them that we're moving forward with the questionnaire survey.
I don't have a lot to add, but I really appreciate the participation today in our talk. And it's super helpful for us to hear this kind of feedback all the time. So we look forward to more conversations like this. And also, please come out to our event. It is on a Saturday, so we are trying to do everything we can to make times available for folks who work and have children and have other things going on. And I look forward to learning more about the community and yeah, that's it for me.
All right. Oh, yeah, that is what I also respond to that comment you made, Leanna. The council was definitely on board with this because they authorized they actually issued a resolution in support of the community health assessment. We were able to, LaDon and I were able to go in front of them and explain to them the purpose and the need and the focus of the community health assessment. And, you know, they were unanimously on board with us moving forward with this process and trying to help build the knowledge so that we can build capacity in the future. I hope that we can get more support for like you know, major infrastructure you know, projects in the future to help build capacity. Like we have some funding to for a wellness center, to build a wellness center in the future. And that was something that the tribal council was very supportive of. And so that is something that's coming in the future, you know, and we don't know exactly what that is going to look like. But the council and governor and administration are very interested in what the community would like to see in a wellness center for the Pueblo. So that is coming. The funding has already been identified. So it just depends on timing and you know, how, you know, what the community would like to provide input on and how they would like to see it developed. So that is something that is hopefully going to be done within the next year. That's my hope. Um, but we shall see. Um, and we are always bringing these ideas up. I've been in conversation with several tribal council members about different health initiatives. So there are some ideas that are being floated around, and they are part of the conversation. So there are things that are going on behind the scenes that obviously the community and the public are not quite privy to. But I just wanted to answer those questions that you had or comments you made, Leanna, about that. Tribal Council is actively involved in some of these initiatives. It's just taking some time to get things on board. We have new council members, council reps that have just been elected, so they're still trying to find their way around how they're going to participate in these activities. But the support is there. And to hear comments that you guys are providing today, the input that you're giving is going to help us to communicate some of this information to them even better, because we can talk until we're blue in the face, but when you hear from the community, that's what's most important. And that's the other reason why the community health assessment is important, because it's coming directly from the community. It's not coming from HHS that's saying we need to do this, we need to do that. That's what we say is irrelevant if it's not supported by the information you all provide. So thank you all again. I said I was going to stop talking, but I talked again. I apologize. But I'm really passionate about this project. This is something that I've been focused on doing since I started in my position. And now that we have it, in the process, it's a great opportunity. And I appreciate you all for wanting to participate and providing your input. And with that, I'm done. Any final comments, questions, concerns?
We're good.
All right.
I'm good.
Well, again, thank you all for joining us on our community health assessment conversation and discussion. We will have more of these. There's not going to be the last time we have these conversations, but we just wanted to get more in depth about discussion about what we were working on and trying to accomplish here, so that the community understands. And I know more questions will come up, so we'll have more conversations, especially after the Saturday. So thank you all again, and have a good rest of your Tuesday.